Okay, so today we're going to be talking about Duchenne's muscular dystrophy, which is also called DMD. So, it is a hereditary neuromuscular disease caused by a mutation in the dystrophin gene, which leads to progressive muscle fiber degeneration and weakness. Typically, it's seen where fibrous connective tissue and fat replace muscle, and it affects mainly striated muscle, cardiac muscle, the brain, and retina. And while it's mainly a recessive trait, about 30% of cases are due to new mutations.
It's estimated that 1 in every 3,600 male infants are affected with DMD, and it affects boys more than girls. 2.5 to 20% of female carriers might also be affected. And then there's about 15,000 children and young adults affected in the US and 300,000 young adults and children worldwide. Some diagnostic measures to test for DMD is serum creatinine kinase, muscle biopsy, electromyography, gene analysis, electrocardiogram, and echocardiogram.
Some major signs and symptoms for DMD will typically appear before the ages of 2 and 3. They affect boys more than girls. The big one is you'll see a waddling gait in your child, and they'll have very large calf muscles, delayed growth. They'll have Myron sign and grower sign. Some big characteristics here are the wasting of proximal muscles before distal. The lower extremity is usually affected first. They'll have a sway back, they'll have hyperextended knees, they'll be toe walkers, and they'll have behavioral and learning disabilities as well. Some major precautions to look out for are muscle damaging eccentric exercises, ballistic stretching, lying or sitting for extended period of times, aerobic exercise, and spinal deformities. Unfortunately, there's no known cure for Duchenne's muscular dystrophy. Um, Usually, the children will end up in wheelchairs around the ages of 10 to 12 and may require ventilator support by the time they reach 20, and their life expectancy is between 20 and 40.
One common medication that is prescribed for a patient with DMD is a corticosteroid, specifically prednisone. This has been proven to help reduce the risk of scoliosis and slow the loss of ambulation, as well as improve timed muscle function, such as stair stepping and pulmonary function. There are adverse effects such as increased risk of weight gain, short stature, osteoporosis, and long bone or vertebral fractures. Other medications include beta blockers, ACE inhibitors, or ARBs, specifically for patients who have cardiomyopathies. Common specialists that will work in collaboration are pediatric endocrinologists or bone specialists, specifically for fractures. A cardiologist is used to approve exercise, specifically if there's any aerobic exercise that is done. Developmental or pediatric neuropsychologists are used for if there's any cognitive or behavioral disorders such as autism or any other disorders on the spectrum. Dietitians are used for every doctor visit. Specifically, glucocorticoids can cause malnutrition, and so dietitians are making sure that they're using appropriate nutrition. Surgeons are used for any surgeries that are performed, specifically on the heart, lungs, or any muscle contractures.
And so, based off of the case's date of birth and the exam date, we figured out that Johnny's chronological age is going to be exactly 4 months. And so, with him being born 29 weeks early in gestation, we corrected his age to be about 1.5 months.
Here's a non-exhaustive list of questions you would want to ask when evaluating a child with DMD. One would be, when did they start to notice signs and symptoms, because this starts to occur around 1 to 3 years of age. You would also want to start looking at if they have contractures, any pseudohypertrophy going on in their calves, increased lumbar lordosis, or decreased DTRs.
And so the outcome measures that we would do with this patient based on the impairments associated with Duchenne's, including the age at which they start showing symptoms and the quick progression of the condition, are the HELP, the DAY-C2, and the GM-FM88. And these are just a couple more general assessments that we would do later on with this patient to help measure his progress and focus our treatment.
For physical therapy intervention, early intervention is crucial because Duchenne's muscular dystrophy is usually diagnosed around age 5. It's important that we get to these patients early to prevent drastic muscle loss, scar tissue buildup, contractures, and possible scoliosis. The main benefits of physical therapy, a couple of them are to slow the progression of the overall disease, but it's also to prolong walking ability and promote independence, reduce risk of fractures, and provide education on energy conservation techniques and adaptive skills they can use as the disease progresses. We can also provide education on how to use and how to get adaptive equipment. The focus of PT should be to preserve active and passive range of motion, and this is especially good in yoga. To preserve, regain functional strength, preserve respiratory capacity with light cardio once it's approved by a cardiologist, gait training, adaptive equipment, and then provide education and support to patients and their families as the condition progresses, reevaluate every 2 to 3 months, and work closely with their other care providers to give them the best care possible.